and I'm just a brief introduction, and Brittany's going to tell you her story. Now, she is an extremely charismatic woman, an actress, very accomplished, and her mother was incredibly charismatic also. And what a shock it was for her to find out she had breast cancer. And we had to act fast. So maybe we can put Brittany on and she can sort of tell us her story.
Hey, Dr. Silver, my fave.
I'm so glad to see you, Brittany. You are
Good to see you too.
truly, I don't want to embarrass you, but I think you can deal with it. It's not fake charisma. It's your heart is so beautiful.
I think big open hearts recognize other big open hearts. You know, you said to Ashley, I can't keep up with my patients the way I want to. Well, that's because you're out giving a priceless gift to other people. So if we have to trade, you know, not being able to keep up with you for what you're doing for other people, yeah, it's kind of even trade off.
That's
So
fantastic. Tell us your
I'm
story.
really glad to be able to give accolades to you and to your entire team because really what you guys are doing is life changing. I was diagnosed with breast cancer on July 7th of 2022. Um, and everything happens really quickly. You know, everybody has this idea of what they would do if they were ever diagnosed with breast cancer. But trust me, unless you've had experience with it before, someone in your family has experienced it already, you're going to just move as quickly as they make you. And let me tell you, they make you move fast. They like shuffle you into this pattern that they've already set. And they kind of fearmonger you into making decisions really quickly. So the first decision that was made that I thought was a good decision, and I still do, was I had surgery fast to get the lump out. Um, what I didn't know is that once you have surgery, if you have the kind of cancer that requires chemotherapy, they need to start chemotherapy within 8 weeks after surgery. So my surgeon was fantastic. He got me in relatively quick. I mean, I had surgery on like the 29th of July. So just weeks after I was diagnosed, I had the cancer out. And at that point, I was no evidence of disease. However, when I met my oncologist on the 18th of August, my whole world came tumbling down. Um, he told me then we had to start chemo, we had to start now, and he was not going to give me time to preserve my eggs. So I'm now 37. I was 36 at the time, and I'm not married. I don't have kids yet. However, that is something that I want to do.
Let me tell you, some man out there is really missing out. Go ahead, though.
So this was it was mind blowing to me because the oncologist, not only did he act like it was just insane that I might ask a woman in her childbearing years that has cancer is definitely going to be concerned about her fertility. But what I find is that there are some doctors that are like, well, you know, yes, I understand quality of life, but this particular doctor was more like, let's make sure you have a life. And I understand what he's saying. But if you're someone who wants to be a mother, what is life without the option or the opportunity to have kids? Now, if I don't have kids on my own, that's fine. But to feel like cancer snatched that away from me and this doctor snatched my opportunity is so very different. So I found out about Dr. Silber in the craziest way. I was not secretive about my cancer, not because I wanted pity or anything like that, but just because I feel like when you have conversations with people about what you're going through, magic happens. And oftentimes, someone is going to offer something. I got so much information about different like vitamins or different ways. And oftentimes, cancer patients are not open to things that people suggest because it gets annoying. But I was at a gym and I shared my story with some ladies that I buy waist beads from, and they shared my story with an IV therapy nurse. That IV therapy nurse, after I worked out, came out and she said, "You need to look up Dr. Silber in St. Louis." I was like, huh? She was like, "I think he helps cancer patients. I'm not really sure, but I know he does fertility stuff. Just look him up. I said, okay. All I did was open up a Google Chrome window, typed in Dr. Silver's name, and I said, I'll get to that later. That was 5 days before I found out that I was going to have to start chemo immediately. So my sister had a wedding on that day. After the wedding was over, I go back and I just go into the rabbit hole. I find Dr. Silver on YouTube. I look through his website and I'm like, oh my gosh, who would have known that just sharing my story with some people that I work out and buy things with would lead me to the pioneer of a fertility treatment that is going to be the thing that I need. I'm certain of it because I don't have a husband. So who am I going to make embryos with? Nobody, right? there's no embryos to be made, right, Dr. Silver?
Right.
So that night, this is where the power of what you guys do comes in. I sent in a request for information and I said it was urgent. And Kelly messaged me back with a date in October 4th. I won't forget it. And I said, I'm sorry. This is really urgent. They're trying to make me start chemotherapy like right now. And Kelly messaged me back, oh my gosh, I'm so sorry. I'll see you next Thursday. That was August 25th. So we have a Zoom call and I mean, I'm greeted by the warmest spirit ever. Ashley said, I don't know if loving is the right word. Loving is the right word. That's exactly how I would describe Dr. Silver. He came on and we just had a conversation and it was a choice. He told me, he said, I have a friend that works in real estate and they told me that within 60 seconds, the person knows if they're going to buy this house or not. And he said, when you got on, I knew. And I felt the same way. Like, this is the person who I know I can trust my fertility with. And that's what happened. Dr. Silver was on his way to Israel.
Yeah, that's right. I remember.
He was leaving on August 30th. It was August 25th when we had a conversation. I was in Portland, Oregon, working on a show. And they said, if you can get here Monday, we will help you out. And that's exactly what happened. My mind was blown. Not only that, Kelly had very specific, easy directions for me to follow. Everything was set up. I didn't have to worry about anything except for getting to St. Louis. And that's all I did. And you guys took care of the rest. I've never been in such good hands. I mean, from every person that I was handed off to, and I was handed off to a lot of people before I actually got to see you. It was the perfect morning. It was just, I knew I was okay.
Fantastic. You know, I believe it was the next day I had to go to Israel.
It was the very next day.
I said, if we can just do it, was it Monday or Friday, whatever it is?
Monday.
If you can get here in time for Monday, which I thought was really asking a lot, we can do this. And you were going to start chemo, I think the next day or 2 days later.
Yeah, it was actually like the next week. And it just worked out so amazingly. Like I had that surgery that week and then they put my port in the next week and started chemo. I was just under the knife the whole time.
Yeah, well, that's important that you didn't have too much pain afterwards that would interfere with your starting chemo.
Nope, I was okay because, right after that, I laid down for a few days. You gave me that the long lasting, what is it?
Yeah, we gave you an anesthetic that lasts 2 to 3 days.
Yep. And what that did was allowed me to get back home to rest and not have to move around too much. I actually was able to get out of St. Louis that night.
I know. But it's funny that long acting, it's a local anesthetic. It's not just, you can't really purchase it. It's a combination of ropivacaine, which you purchase, Toradol, which you can purchase, and morphine. And Toradol and morphine, they can work on your brain for pain relief, but that's very inadequate. But when you inject it in the surgical site, the receptors hold on for 2 or 3 days. And that was first discovered, you never know where the best ideas are going to come from. That was discovered by an anesthesia department in University of Cork in Cork, Ireland. You never hear about, you don't know where the greatest new discovery is going to come from. So
Yeah, it was perfect because, the next day I was like, if I would have stayed in St. Louis, I would have been in St. Louis for the rest of the week.
well, this is great. So, I mean, your story is going to help a lot of people because you're right. Cancer patients are rushed, and most of the oncologists aren't really aware of what can be done to preserve your fertility. And I believe we have the only ovary freezing program in the country with transplantation to prove that it works because we started this in 1997.
Well, here's something beautiful. Well, first of all, I finished my chemo yesterday, so I
Great.
get to ring the bell, and that's done. But it is so unheard of. The doctor that I talked to first was like, "I've never heard of that. I've never heard of someone freezing ovary. Do you mean eggs? You must mean eggs." I said, "No, I'm telling you." So you got your eggs taken out? No, I had a whole ovary taken out. Do you want me to show you a picture of it? Because I have it.
We have pictures we can send you if you don't have them. But if we were to try to freeze your eggs, it would be IVF stimulation. It would be a month later, and they're not going to give you that kind of time. I mean, we could freeze your eggs too, but we just didn't have that kind of time.
Yeah. And you guys taught me so much about how the body works. You were saying earlier, people don't do the research. Just generally, people don't really know how an ovary works because I think we all think that we're running around here with a sack of eggs just in there, just jingling around. And that's not it.
Even in fertility centers, I have to say they don't really know how the ovary works really well. And that's because you need to have experience and studies. We've written these all up and reported them, but still, often the fertility center just thinks we'll give you gonadotropins and we'll get eggs, we'll retrieve eggs and freeze eggs. And I mean, we actually developed the technique for freezing eggs as well as freezing ovary tissue. But you can't just do this, I think, robotically, like a robot. I think to really, well, any kind of medicine, I believe you have to understand the science.
Mhm.
You can't just be clearly a clinician. You have to be a scientist too.
Yeah. Yeah.
But you're such a loving person. How are you doing? How is your acting? Has that been on hold for a while or?
So with my first portion of chemo, I finished the show that I was working on. So I started chemo in September, and the show ended at the end of October. So I had 4 treatments, 4 of the hardest treatments. They call it the Red Devil during that time, and I continued to work. And what I know now is that this is so mindset based. And I'm grateful that I gave myself that challenge because the chemo was very difficult. And if I didn't have any reason to get up, I may have wallowed in my sadness about the fact that, I'm the one that has to have chemotherapy. But I had to get up and I was able to live through the energy of my character. I know that sounds all woo woo, but she was very active and fun. And I was able to use that, excuse me, and get up every day. So I've been very healthy. Um, After 16 infusions, your body is tired. It's been over the course of 20 weeks. My body is tired of it, but I still work out. I still see my friends. My hair is already growing back. It's
Well,
been
actually, I must say, although you were beautiful with your regular hair, this is very stylish. I like the look of this too.
Thank you. I got a lot of compliments about my bald head. I was really grateful that I had a good head shape because you never know. It's been a ride, but and I wouldn't tell anybody to sign up for it, but I've learned a lot. I've gained a lot, and I think that if you allow it, cancer will teach you some really important lessons about life and its value.
Now, let me tell you something ironic. You're 36 years old then. I don't know if you've had a birthday since then or
Okay.
not.
Yeah.
Okay.
Mhm.
But if you never had cancer and you just waited because you didn't meet the right guy or want to have kids until you were 40, you'd be infertile and you might not ever have a baby. I mean, we do IVF with women as old as 47, but the results really go down dramatically between the ages of 36 and 40. And so it was maybe, I don't know if you're religious, but it was a blessing, really, a disguised blessing that you had cancer.
100% a gift. I tell people all the time, like, oh my gosh. Now I can stop being weird on dates with these people and I can just have a regular dating process because I can still have a baby when I'm ready. I don't
Yeah.
have to rush the thing, you know?
You don't have to marry the first jerk you meet, you know. You can- you're free to make an intelligent decision, not a rush decision.
Exactly. It really is a gift. And you said while I was there, if I was a king, I would order every 25-year-old to have this process, this procedure done. And it's so true. Like
Yeah.
I wish I would have known, right? Like that this existed. It unfortunately took tragedy for me to find you. And if that's what happened, then so be it.
So COVID was a special blessing for Ashley, and cancer was a blessing for you.
Absolutely.
It's amazing,
Absolutely.
really. God works in strange ways. We can't know what He's on His mind.
Seriously.
Maybe I should say her mind. I don't know. I don't want to irritate the woke culture.
It'll go down. They'll be like, cancel him, cancel him. Yeah,
Oh,
but I
this
thank you so much. You really are doing priceless work. I cannot thank you enough.
well, the thanks is just from knowing that, knowing you and knowing you're going to have a great life. And who knows? I may not even be around when you finally get married and have a baby. I mean, that ovary is going to be 36-year-old, even when you're 100. So you can have
No,
a baby at any time.
you have to be around because you're gonna have to interview him.
I'll do that. I'll do that. There's been a lot of studies, and this isn't so relevant, but you talk about your purpose and being your character, and a lot of studies show that you live much longer if you have a purpose.
Mm.
It's neuroradiology. They can image your brain and see that your axons are less likely to deteriorate if you've really got a purpose that you care about. I mean, it's not. It sounds woo, but it's not. It's very well documented now with the new imaging of the brain.
Well,
Yeah,
thank God that I found things that I love and that I want to be here for.
that's right. Exactly. Yeah, yeah. He'll usually give you that extra time if you've got something good in mind.
Well, I better keep coming up with more and more for this list. Like I gotta read on this, and now I need to work on this.
Well, this is great. I believe our time's up, but I want you to continue to let me know how you're doing.
I will.
You look beautiful. You don't look like you had chemo. I mean, I'm just floored by you. Just don't look sick at all. I'm really excited.
Thank you. That was my goal, to not look like a cancer patient. I managed to be all right about 17 out of the 20 weeks. There was a couple weeks I was like, I didn't make it. I look like a cancer patient today.
It's miserable, isn't it? Yeah, it's really miserable. So, and that's it. You're done with it now completely. Is that right?
Yeah, I have to follow up with radiation, but is nothing compared to the chemo.
And they're going to let you get pregnant in 5 years. Is that the rule? Or?
Well, luckily for me, mine wasn't hormone based, so that's not a.
So they don't even care. Yeah.
Mm,
Okay, that's fantastic. Well, you're going to be a great mother because that's what it takes. It takes a loving heart. And your mother was a fantastic mother because I queried you about her. I remember that.
yeah, my mom.
I always wonder, where does this kind of a soul come from? Well, it came from your mother.
Absolutely.
Yeah.
Absolutely.
Well, okay. So I think it's time to sign off. We've been here for about 40 minutes, and I just like to say that this is Brittany Caldwell, actress extraordinaire, who is telling her story about fertility preservation and cancer. And I'm Dr. Sherman Silber, Infertility Center of St. Louis. You can write at infertile.com, or you can call us anytime. We're easy to make appointments with, and I just love what I'm doing. I'm kind of an old guy, but it doesn't matter. I feel young. I swim a mile every day, and what keeps me so vigorous really is just that the first commandment is be fruitful and multiply, and so that's what I'm trying to work on. Okay, so it's great seeing you again. We'll stay in touch.
Yes. All right. Thank you.